Now that a year's passed and vaccinations are becoming more readily available, how is the ophthalmic industry adapting and how has it changed? In this episode of OCuTALK, we're talking to Dr. Amanda Salter about practice changes and the increase in cases of dry eye due to mask use and increased screen time. Dr. Salter?
I want to talk to you.
Not now, later.
No, now.
Hello, everyone, and thank you for joining us for a brand new episode of OCuTALK. My name's Nick, and today we have a very special guest joining us. From Shambaum Eye Specialist in Berkeley, Michigan, Dr. Amanda Salter. Dr. Salter, thank you so much for joining us today.
Thank you so much for having me.
Well, it's a pleasure to have you here, Doctor. Thank you so much for joining us. And Dr. Salter, before we get started, I was hoping that maybe you can explain your background and your specialty to our viewers.
Absolutely. So I grew up in the Metro Detroit area in the suburbs, and then I went to University of Michigan for undergraduate. And then I went out east for all my medical training. So I went to NYU for medical school, and then I stayed out east and I went to Rhode Island to do my ophthalmology residency at Brown University, which was an excellent, very grueling, but very in-depth residency that has me highly prepared as a comprehensive ophthalmologist. I actually stayed out east and practiced in Massachusetts for a couple of years. And then I returned back to the Metro Detroit area to be closer to my family. And I'm doing comprehensive ophthalmology here, which I love. I get to see a wide variety of ages and backgrounds and ocular disease. So it's great.
Well, that's awesome. And again, thank you so much for joining us, Dr. Salter. And Dr. Salter, as a comprehensive ophthalmologist with an expertise in so many areas, what patients do you see most frequently and what cases do you see most often?
So, I think, as I mentioned, with comprehensive, it's really fun because you kind of never know what you're going to get, especially with the emergency patients. But certainly there are things we see most commonly. And I think for myself, some of that's tailored to what I'm more interested in and what I've sort of gained an expertise in. So I do a large majority of dry eye, which I really like. And so I've kind of cultivated a population of patients for that. And then I do a lot of cataracts and a lot of glaucoma. Many comprehensive ophthalmologists are also doing a lot of diabetic eye exams, macular degeneration checks, and then personally, and I wonder if other ophthalmologists will find this true, during the pandemic, I think there's been an increase in cases of styes and chalasia, like a lot. So that's something I've noticed recently, and also more cataract cases recently as well.
Excellent. Thank you, Dr. Salter. And you mentioned during the pandemic, so I wanted to ask, during this past year and with the new vaccine rolling out, how has this impacted the eye care industry and in particular your practice?
Sure. So I think, as the eye care industry as a whole, ophthalmology and maybe more so comprehensive ophthalmology has been hit some of the hardest, especially during the shutdown. A lot of our cases and surgeries are elective. And, particularly about a year ago, all of that was kind of shut down temporarily. And so that really impacted, like I said, particularly comprehensive because we're not doing the emergency retinal surgeries and that kind of thing. And also, large majority of a population for most comprehensive ophthalmologists is going to be, more elderly with comorbid medical conditions, and those patients are at higher risk. And I think there's definitely a portion of those patients that didn't feel comfortable coming into the office or exposing themselves, which is very understandable, of course. And I'm starting to see some of those patients coming back now that we have the vaccine. Unfortunately, some of those patients had chronic conditions like glaucoma or diabetes where, maybe the symptoms, basically those are asymptomatic conditions. And so they've had some progression, unfortunately, but I'm glad to have them back now with the vaccine. Also, as far as how is my practice affected, last April, we basically shut down, only open with a skeleton crew for emergencies. And that we did do some tele-ophthalmology. It's a little, it's more of a type thing because it's hard to do a full eye exam via tele-ophthalmology, but certainly helpful for some of those patients who didn't feel comfortable coming in. And we've learned to adapt to things have built back up, but certainly trying to keep social distancing not back to baseline yet, I'd say. And of course, we have to adapt to everybody needing to wear masks, proper cleaning of our equipment in between patients, spreading everybody out. And I think also unique to ophthalmology, masks have presented an interesting challenge that we've all had to adapt to. So obviously masks are so vital for preventing the spread of COVID, but they also fog up our equipment. And anybody who wears glasses is, accustomed to this as well. But when you're trying to measure for glasses with the 4-opter, that's fogging up. When we use handheld lenses to do a retinal exam, those can fog up. And then, for example, also doing a visual field test, you can get artifacts on the test if there's fogging inferiorly. So, we kind of tape people's masks. Somebody actually invented an adapter that goes over your handheld lens to block the airflow there. So I think there have been some creative adaptations in the eye specialty to kind of combat the interesting challenges we've had to, deal with here.
Well, definitely interesting challenges. And it's funny that you talk about like mask associated issues. I was actually going to ask you, can you talk a little bit about mask associated like dry eye and computer vision syndrome? Like, have you seen a lot more cases of dry eye now?
I think so, yes. I mean, remember, dry eye is really an epidemic to begin with. Somewhere between 5 and 15% of the US population has dry eye, and a lot of it is underdiagnosed. But I think definitely with the mask wearing and the screen time, it has gotten a bit worse. So mask-associated dry eye is basically when you're wearing a mask that's not fitted properly, the air is essentially directed right up the top of the mask and like directing the flow of air over the surface of your eyes. So it leads to faster evaporation of your tears, and then you end up with all the symptoms of dry eye, so of which there are many. So to name a few, redness, burning, itching, teary eyes, irritated eyes, feeling like there's something in your eye, off and on blurring vision. So in ways to combat the mask-associated dry eye, I think the number one way is to make sure your mask fits well. So you want to get a mask that has a nose wire so you're pinching it properly. You want to make sure it's fitted more tightly around your face. If you need to like cinch the earpiece or double loop it, those are ways that will help. And also remember, ambient air. So if you're in a really highly air-conditioned space, that's going to lead to evaporation too. So trying to avoid that. And using artificial tears. So I think those are the ways that we can sort of combat the mask-associated dry eye. As far as the computer-associated issues, so, screen time has increased for everybody during the pandemic. So whether you're working from home or I have a kindergartner doing virtual school downstairs. Yeah. So, we're all on the screen so much more. And the research shows that, when we stare at a screen device, we blink at least 50% less than normal. And blinking is so important because it does a few things. Number one, it helps drain the tears. Number two, it spreads the tears over the surface of the eye. And number three, it actually acts as a pumping mechanism to help the meibum come out of the meibomian glands. And that's really important because that's the oil portion of the tear film. And so that will help decrease the evaporation of our tears while we're staring. So, the blinking is so important. We don't blink as much. So there are a few things I think that leads to more dryness while you're on the computer, but there's also just eye strain from not taking breaks and staring at the screen and sitting too close to the screen or not having good lighting. And they've also shown over the course of the pandemic, there's an increase in nearsightedness with a lot of computer or near work. So I think there are a few things that we can do to sort of combat all of that computer-related eye strain. So number one, I always recommend to my patients the 20-20-20 rule. So every 20 minutes, you need to take 20 seconds and look 20 feet into the distance. And I usually add to that, you want to do some forceful blinking exercises during that time to kind of get the tears flowing. So that I think that helps as well. Also, if you're on a computer for hours during the day, a desktop humidifier can be really helpful, just keeping the air around you more moist. Again, using artificial teardrops, that's really helpful. Make sure you're sitting a good distance from your computer. So usually arm's length away is a good rule of thumb. And also make sure that you have good lighting, like increase the contrast on your computer so it's brighter so you're not straining so much to see. And now, sorry, another thing I think is key too, like For example, I'm home with my kids so I can see. Does it seem like she's not seeing well? Pay attention more to your kids. You might need to visit your eye doctor and see, like, maybe it's not eye strain, maybe you need glasses.
Well, that's all perfect. That's great advice. And actually, you were actually talking about it earlier, but the 20-20-20 rule that you give to your patients. When you talk about dry eye and like eyelid conditions to your patients, what other recommendations do you give to your patients?
Yes, excellent question. And I think dry eye is one of those things where, it's every patient is so unique, and you have to look at so many factors. We have to look at what other conditions they have, for example, blepharitis, meibomian gland dysfunction. Do they have other systemic conditions like Sjogren's or rosacea, or rheumatoid arthritis? Are they on antihypertensives that could affect their tear film, or do they have allergies and they're taking an antihistamine that's going to decrease that? So there's so many things to look at so you can tailor the regimen. But having said that, I think pretty much every dry eye patient is going to benefit from artificial tears and a good eyelid hygiene regimen and warm compresses. So I can talk a little bit about that. Personally, I prefer preservative-free drops because then, if you're somebody who, number one, has really severe dry eye, the preservatives are just going to make that worse. And some people really like to use them frequently. And if you're using a preserved drop more than 5 or 6 times a day, you're kind of going to add to your problem with just the preservatives causing irritations. So I just tell people, just get the preservative free, then you don't have to think about it. You can use it as much as you want, and it won't kind of add to that. Especially as we come into allergy season, people who are really prone to allergies, it's good to eliminate that as well. And then as far as eyelid hygiene, I have a couple of favorites, and OCuSoft is definitely among them. They're for any person who wears makeup or like eye cream or anything. I usually suggest, if they have mild to moderate blepharitis, or even if they don't have blepharitis, it's still a good idea. I suggest using either the OCuSoft Original, or I also like iEco Tea Tree Foam. And I like both of those because they're kind of a 2-for-1. You're getting a really good cleaning of your eyelid and it removes your makeup. And so for women who are wearing makeup every day, you don't even think about it. You don't have to use makeup remover. Just you're cleaning your eyelids and you're getting rid of your makeup. So I like those. And then for more severe blepharitis patients, particularly preoperative patients, I really like the hypochlorous acid spray. So I really like the OCuSoft one. That's excellent. Also like Sterilid and Avenova. So I think those really do a great job of clearing it up quickly. So if I have like a cataract pre-op patient that has blepharitis, I just kind of go right to the hypochlorous sprays. Those are excellent.
Well, awesome. Well, we're definitely excited that you recommend our products, and we appreciate that. And Dr. Salter, are there any new technologies or new developments that you see on the horizon for all of this?
So there are always new things in ophthalmology. Sometimes it's hard to keep up, but it's also what makes it such a fun and interesting specialty. So there are a few new things that have come out, and I can talk about a couple of those. I'm sure I won't even be scratching the surface because, as I said, we're always coming out with new things. So in the dry eye realm, we had the first FDA-approved steroid drop for dry eye, which is Isuvis. Of course, there are many other steroid drops that I'm sure many of us have used off-label, but now we've got an on-label one. And I just tried, there's the open eye warm compress, the tear restorer. So that's kind of a neat thing. You can do your compresses and still walk around and do your thing. And then as far as glaucoma, we have the Durista implant, the bimatoprost implants. That's kind of cool. And then the new iStent Inject W. And then in the realm of cataract surgery, we've got a couple of new implants. So the Vivity, which is an extended depth of focus. And then we have the iHance, which is sort of like a monofocal plus. So both of those giving more intermediate. So another kind of, option to suggest to our patients to get them less dependent on glasses, which is great. And then I mentioned we're getting into allergy season. So having said that, I'm really excited that there are really great options over the counter for patients, because I think that was a challenge before. So now we have 3 different types of Pataday over the counter and the first preservative-free Alloway drops. So, definitely something that is available to patients, and it's not, a crazy expense, which is really nice.
Well, that's awesome. We'll definitely be on the lookout for those new developments. Thank you, Dr. Salter. And before we go, Dr. Salter, was there anything that you'd like to tell our audience?
The one thing that I would say, outside of feel free to use artificial teardrops instead of Visine, because anything that kind of decreases the redness is usually not treating your problem. And if you think you have a problem that's not served by something over the counter, don't hesitate to visit your friendly eye doctor. And as we're going into the summer months, the most important thing you can do for your eyes is wear sunglasses with UV protection. So that's my public service announcement.
Well, that was a great public service announcement. Thank you, Dr. Salter. Everyone, that was Dr. Amanda Salter with Shanbaum Eye Specialist in Berkeley, Michigan. Dr. Salter, thank you so much again for joining us today.
And thank you for having me.